I think people sometimes don't understand why we are so aggressive with trying to reduce C-section occurrence. A lot of folks are like, C-sections can be a life-saving procedure. Of course it can. Following that life-saving procedure are still lots of layers in terms of how that person will be impacted, how they will feel about their birth. How prepared are we for that person to have to go through a complete bodily transformation and be recovering from an abdominal surgery? This impacts your entire family. This is gonna impact that woman's health for the rest of her life. What are some of the things that y'all actually tangibly do to support your families in helping to make sure that they avoid what is truly an avoidable C-section?
So midwives solely focus on a vaginal birth. And so in my practice, we really focus on having this collaborative team effort with the patient being centered in their wishes and their desires. And so we've even incorporated our nurses to learn, techniques about movement. We also encourage staying at home as long as possible, in addition to having a doula to help you while you're at home. And when we do that, we notice a very drastic decrease in our C-section rate.
What I feel like as a midwife is most important is not necessarily whether a woman has a vaginal birth or a cesarean or an epidural or no epidural, but it's that at the end of the experience, they feel like they were the most important part of their experience, and that their voice was heard and their preferences were honored.
Yeah, I think you bring out a great point, and that's something that we work as doulas with them, is kind of plan that out, and let's help the provider learn more about what your wishes and your wants are.
One of the reasons our practice has a low cesarean section rate is because we're extremely patient with our labors. And the research is really supporting that, allowing time for a longer labor, a longer pushing phase, as long as mom and baby are both doing well. Because of the potential risks of repeated cesareans, it's really important that we help prevent the first cesarean if it's unnecessary, because a first cesarean does significantly increase the chance that a woman will have a cesarean with her subsequent deliveries. So one of the things I tell women who want to prevent an unnecessary cesarean is to have midwifery care, because that has been proven to reduce C-section rates, in addition to having a doula's support.
That's one of the things that we tell our clients as well, in how beneficial it is to their health. Having that extra person in the delivery room who already knows them, they have built trust, who knows the system, who will help them advocate for them if they need it, and someone who probably knows the culture, the language, and so we're kind of like that bridge, between the health system and them.
And we're gonna start with a deep cleansing breath. So that's in through your nose, out through your mouth. As your doula, I am here to support you in the birth that you desire. So tell me a little bit about what kind of birth are you planning? How do you see it going?
Definitely see it without an epidural, without any interventions as far as like induction, Pitocin, or anything else.
Okay.
I definitely want a VBAC because my first baby was a C-section. So that's something that I definitely want. I want to experience. I feel like the birth that I was robbed of from my first birth.
Okay, so it sounds like your experience the first time around is really guiding you and doing something different.
Exactly.
This time.
Yes. My last birth, I was induced when I didn't have to be induced, because I walked into the hospital already in labor, contractions already like 3 minutes apart. The doctor decided to still give me Pitocin and Cervidil. I did not respond well to either one of those things, and he did not either. His heart rate dropped, and that's what led to the emergency C-section. And he ended up staying in the NICU for about 3 to 4 days. So I wasn't able to do that first, like skin to skin, first breastfeeding. It was really traumatic.
It sounds like it. And I'm hearing that it sounds like things went very fast.
Yes.
It sounds like there were times where things were given to you and you weren't really sure as to why you were receiving them.
And I didn't know to ask questions.
And then it sounds like oftentimes you felt like there was no space for you to ask questions.
Yes.
Yeah.
I was just kind of like following what the doctor said, and whatever the doctor said, that's what I was supposed to do, instead of just advocating for myself. So
Absolutely, because you are part of the team, right?
Exactly.
Doctor says this is what we should do. There is no harm in asking.
Exactly.
Why? How? What are the alternatives, right? Always
Exactly.
asking so that you are an active part of the decision making.
Yep. And I think I know better now.
And
Second
most
time
doctors,
around.
most doctors are happy to tell you. You
Right.
just have to ask.
Exactly.
Your body is awesome. It's amazing. You'll be surprised how amazing your body is. Let's try to use it. Let's do breathing techniques. The walking, I need you to get up and let that gravity go, because it's the gravity that really helps and put the pressure on the cervix.
One of my clients, when she was in labor, they had to induce her, but the baby wasn't all the way positioned correctly. So her OB had told her, like, okay, well, we just trying to help you get your body right, but if the contractions are coming really strong and consistent, but you're not dilating or the baby's not dropping, we might have to give you a C-section. And I was thinking to myself, oh my God, all she got to do is like let's try to reposition her and do some different things. And thank God she did. We prayed over her.
What you do, that's the step right there.
Things just changed.
She was receptive to your moving, and your role was vital in making sure that she had a vaginal delivery.
I really love that doulas help reduce the cesarean section rate. We've got lots of data to support that. Sometimes C-sections are the best tool we have and absolutely necessary, but we want to make sure that we're only doing it when we really need it, because there are some potential risks with cesarean. You know, it's a more dangerous procedure for mom, certainly, than a vaginal delivery. And then particularly for women that want to have more than one baby, it really increases the odds that they might need a second cesarean.
If we were to end up with another C-section, how would you feel about that?
It would be disappointing at first, but I want myself to be safe, and I want my baby to be safe as well. So if it ends up being that way, then that's just how it's going to have to be.
I hear what you're saying, disappointed, and that's a very valid feeling. Babies are born in lots of different ways, and regardless of our best laid plans, this baby will come the way that it needed to come.
Yes.
And so if we made informed decisions, if we were an active part of this team, if you felt confident and supported the entire time, we really shouldn't feel too disappointed in that, right? We had the birth that needed to happen.
Yeah.
And we tried our best.
We did.
Another C-section is not a failure. It's just a deviation from our plan.
Exactly.